In the next round, the team that is scored the maximum gets the choice to pick up the system. I will show you some systems on the screen, and the team which is at the highest score gets the chance to pick up the system, and then the team next highest. So whatever is your score in the last round will help us to determine, and team which has scored lowest in the first round will have to take whatever is left in the end. Okay? Okay. So let me show you so the team B gets to, okay. So it is according to the, okay. So should I allow the team A to pick up first? Team A is the one which is picking up first. The systems available to you are cardiovascular system, immunology, GIT, neurology, microbiology, endocrinology. You can pick any of them and you will get 2 questions from that system, 2 questions. Rules will be same, bounce and pounce. And self bounce also. Okay, what do you want to pick? He says they like GIT system. GIT, very tough questions. Okay, but you have done it. Okay, so sorry. Okay, GIT, team A. Are you ready for your questions here? Team A. Everybody ready to pounce and bounce? Yes, incomplete answers. Now we will not be, gracious about incomplete answers. Incomplete answers will attract negative marking. Okay, enough. Now we are getting into serious quizzing now. There is a prize to be won here. There's a prize to be won here for the winner. What is the prize? 10,000 rupees. Oh my God. So you have to be very serious. We will cut all the marks for you. Now, GIT, team A, ready? Team A, ready? Okay. Again, you see a clinical vignette. 26-year-old man has intermittent cramping abdominal pain, low volume diarrhea for 3 weeks. On examination, he is afebrile, mild lower abdomen, tenderness, no masses, bowel sounds are present, stool sample is positive for occult blood, symptoms subside after 1 week. 6 months later, he had a perianal pain, perirectal fistula, colonoscopy shows mucosal edema, ulceration, biopsy shows chronic inflammatory infiltrate, crypt abscesses, noncaseating granuloma. 1 month later, he has pain from loin to groin. X-ray KUB is shown. I want to know the composition of the pathology shown in the X-ray KUB and the pathogenesis of the pathology shown in the X-ray KUB. Okay, wait, let me show you the X-ray, then the window will open. Let me show you the X-ray. This is the visual. This is the visual. Okay, this is the visual, but the question is, what is the composition of the pathology and what is the pathogenesis? Both of them have to be right. Pounds window opens. Team A has also pounced. Okay, pounce window is now closed. You can't pounce any longer now. Okay, there's a time to earn marks. Everybody now? Okay, so who all got the right? Team A, B and C all get it right. Plus 30 for all of them. Now, before I tell you the answer, let me pass the question to Team D. Team D. Achha, this is self-pounce. So they've already answered. Okay, very good. So nobody gets the pass here. So they all get a score here. So it was a good idea to score. Anybody from the audience wants to tell us the composition of the findings shown on the X-ray? On X-ray you see radio-opaque stones in the kidney. What is the composition? Calcium oxalate. But what is the reason here is the keyword. So let's look at the keywords. He has an inflammatory bowel disease with perianal fistulas, noncaseating granuloma. Do you want to venture and give me an idea on the inflammatory bowel disease? Crohn's disease. We are looking at Crohn's disease. But the question is not that. He has X-ray of the KUB and there is a stone, which you are saying calcium oxalate. We want to know why he has developed calcium oxalate stone from the audience. Correct, and she's right. She gets a prize. I'm sending an audience prize to you. Very good. Everybody give her a big hand. So the idea here is that there is fat malabsorption. So there is the calcium binds with the fatty acids. As a result, more oxalates are absorbed. And that is the reason why he had an oxalate stone in the X-ray. So very good answer there. And I think all three teams could get it right. Very good. Okay. Now, Team B. I go back. Okay, now we have one more question for team A. We have one more question for team A. One more question for team A. Okay, why does long-term oral antibiotic therapy lead to mild watery diarrhea? But I am saying it is not about pseudomembranous colitis that I'm asking. Long-term oral antibiotic therapy leads to mild watery diarrhea. Why? Time to pounce, everybody. Okay, pounce window is open. You can pounce. Quickly, tell me. Okay, should I close the window? No. The timer is going very slow. What phone, what stopwatch are you using? It should go faster. Window is now closed. Now you can't pounce any longer. So team A, time to answer it directly. Reason. Are you writing a long question here? Give us one answer. You are saying it is an infective colitis that has happened. Am I right? This is what you're saying, infective colitis that has happened. Shall we pass it on? Okay, so we pass to the other team. Pass it to the other team. Why do oral antibiotic therapy lead to mild watery diarrhea? It is not pseudomembranous colitis that we are asking. They said infective. I don't know if it is right or wrong. We see the other team what they say. Don't tell her. Team B, what do you want to say? Team B. Team B, what is your answer? Team B. You're leading the pack. You can just take our answer here and take some marks. There's no negative marking in a bounce. There's no negative marking right now. You want to say something? They say pass. Okay, team C. They say antibiotics are osmotically active leading to this. So we go to team D. Team D say pass. Team E. Team F. I think partially okay. Okay, so we give the answer to you. The answer here is that gut flora produces short-chain fatty acids, which you correctly mentioned. We give you the pass marks, which nourishes the intestinal mucosa. Their absence leads to mucosal atrophy, watery diarrhea due to loss of iliac channels is the answer. So we partially, I think they were right. They talked about the fatty acids and we give to the F even. Pass marks, huh? Whatever pass marks. Whatever you get in a pass. So now we can go back to the systems again. We go back to systems again. Now which team gets to choose it? In order. Team B. Now you get to choose any system other than GIT. They are picking up microbiology now. Microbiology is the system that they have picked up. There will be 2 direct questions. Everybody is open to pounce and bounce. Team B. Okay, Team B. Microbiology question for you here. Direct. 46-year-old man has increasing abdominal distension, decreased libido, 7 months. Physical examination has skin pigmentation in the sun-exposed area, moderate splenomegaly, abdominal fluid wave positive, fasting serum laboratory shows glucose 200 milligram per deciliter, creatinine 0.8 gram, ferritin 650 nanogram per ml, protein 6.3 gram per deciliter, albumin 2.2, bilirubin, AST, ALT, alkaline phosphatase values are normal, hemoglobin is 13.5, hematocrit is 40.6, platelet count is 2 lakh, WBC 6570, prothrombin is 20 seconds, partial thromboplastin time is 65 seconds, patient now has fever, chills, bloody diarrhea, lower quadrant pain, abdominal CT is shown to you. Okay. So there's a fever, lower quadrant pain in a patient where we have already described his clinical profile. Okay? You want to see the profile once more or are you okay with it? Or you want to see the CT? Once I open the CT, I'll not come back to the history. So spend enough time. You know this, that the answer for you will not be in the CT. You know this already. You know it or not? Okay, but you want to see the CT now. Okay, this is the CT. And the question is, what is the diagnosis? Why this person was predisposed to this condition? What is the selective media for the organism implicated? Okay. So we need to know the diagnosis, why it has happened, and what is the medium for this organism which is implicated. I'm just showing the history again. This is the history. And the Pounds window is open. Pounds window is open. Pounds window is over now. Team B, time to answer it directly. Oh, they want to see the question. We are very kind on this. We are adding a word here. The CT is showing mesenteric adenopathy. Do you want to, modify? We give it to them. They were actually totally right on everything they said. So Yersinia is the answer that we were looking at. The hemochromatosis was the diagnosis. Excess iron predisposes to it because they were right in their explanation. Let me show you the keywords. Okay. But you have to just tell us the selective medium before I show you the keywords. Okay, we give an opportunity to all other teams to tell the medium. Anybody wants to give a medium and get a partial mark here? Anybody wants to give the name of the medium? Name of the medium for Yersinia? No? Okay. So let's by the time everybody answers, I think we can just look at the keywords here. The keywords in the question were, there was a liver disease. We got to know there is a liver disease because the decreased libido, abdominal distension, fluid, splenomegaly, they were all talking about a liver disease. There is skin pigmentation in the sun exposed area. We started thinking about hemochromatosis. There was blood sugar more. We added a dimension of bronze diabetes. Ferritin was high. That made us further think about hemochromatosis. But there is fever, chills, bloody diarrhea, right pain, lower quadrant pain. We started thinking of appendicitis. But when we saw the CT, this was not appendicitis, it was lymphadenopathy, mesenteric lymphadenopathy. And then we got a diagnosis of Yersinia. You want to know the medium now, everybody? Everybody is curious. Okay. So the mesenteric adenitis was the finding due to hemochromatosis, due to siderophore capture iron, and CIN agar was the answer that we were looking for. So we'll give them partial marks because it was a tough question. Okay, CIN agar was what we were looking for as the answer in the third statement. Okay, so team B, you have the second direct question coming up for you. Team B. Okay, team B, direct question. Everybody start getting ready to bounce and pounce. Team B, direct question for you. 43-year-old man comes to physician with low-grade fever, shortness of breath, growing skin lesion. He resides in Upper Peninsula of Michigan, works as a landscaper, avoids medical care as much as possible, smokes 2 packs of cigarettes, enjoying life, and he has daily productive cough. Then number of skin lesions which start at painful nodules, then ulcerate, start discharging pus. Physical examination shows right lower lobe bronchial breath sounds, egophony, and the X-ray shows a consolidation in the lower lobe, but no pleural effusion, no hilar nodes, no mediastinal nodes. I want to know the diagnosis and the drug of choice. Is there a picture? Okay, there's a picture for you also. Okay, don't worry. Okay, there's a picture. Okay, I'm taking back the keywords. I'm taking back the keywords. There's a picture for you. Okay, this is the ulcerated lesion that we were describing in the picture. You want to see the history again? Team B? Okay, Team B. He lives in the Upper Peninsula of Michigan, works as a landscaper, has consolidation and ulceral lesion. Pounds window opens. Closed. Oh no, it's all closed. No longer you can pause. Team B. You want to say something directly? Now there's no negative marking. Team B. And the question also said drug of choice. Do you want to answer both of them before I evaluate? They say amphotericin. Okay. So it will go 0. It will be no marks for you. No marks. No marks. Okay. No marks. They get half marks. Okay. So there's something they have told is right. Something they have told is wrong. Okay. I don't know what is it. So we are passing it to other teams. Okay. You tell me what is right, what is wrong. You get marks here, but something they have told is right, something they have told is wrong. I'm not telling so far because it will become easy for others. It passes to others. It goes to team C. Team C. Team C, you want to say something? Colonoscopy. Okay. Team D. They say blastomycosis, itraconazole. They get full pass marks. Full pass marks. Is it correct? Oh, part because the diagnosis they are told so drug is itraconazole. We give you half of the pass marks. Okay. So the keywords here were skin lesion, and the typical location that he's living is Michigan. That was the key word here. A typical USMLE style question. He has pneumonia, but there is no lymph nodes. Nothing to suggest tuberculosis. Right lower lobe consolidation is there, and a nodular lesion which ulcerates. And this was the lesion with blackish margins. The answer is disseminated blastomycosis. The answer is itraconazole. Okay. Everybody gets it? Now I go to the team C. Team C for the system. Team C now. Now you can pick up any system other than GIT and microbiology. Other than that, you can pick up any system. They are wanting to play in immunology. Okay. Is that your strength? Let's see now. Let's see. The time will tell. Team C. Immuno question for you. You have 2 questions and everybody else can bounce and pounce. Immunology it is what they picked up. Don't Google. We have taken questions. We are very tough. You can't even Google them. Don't worry. Okay. Okay. Team C. Direct question for you. 14-month child, multiple infections since birth, including Pseudomonas, adenovirus, aspergillus, diarrhea with isospora, otitis media with Haemophilus influenza, UTI with Candida albicans. Lab study shows hemoglobin which is 13, hematocrit 39.7, platelet 239, 100, WBC 3450 per mm cube. 85% of them are neutrophils, 6% bands, 2% lymphocytes. Serum hemoglobin are 118 IgG. Normal range is given on the side. IgM is 14. I have given you the normal range. IgA is also mentioned, but the normal range is written. It dies of pneumonia. Autopsy, the thymus is hypoplastic. Small lymph nodes which lack germinal centers, and the gut has scant associated lymphoid tissue. You have to make a diagnosis, mode of inheritance, and the corresponding mutation. Whatever mutation you say, we want to know the corresponding mode of inheritance. What is the child suffering from? What is the mode of inheritance? Team C, it is your direct question. Everybody else can pounce on it. Pounce window is already open. You can pounce on it. Team A wants to pounce on it. Yes. So let's see what they've written down. By the time window is now over, now team C, you can directly also answer. But before they let them write first. They've answered it correctly, team A. Team A has answered it correctly. Very good. They got full 30 marks on the side. Very good. Team C, time to speak up. Which one? Which one is the gamma chain one? X-linked or the other one? X-linked. So I think they're correct. They get full 20 marks. Let me show you the keywords. The keywords here were this child has multiple infection, bacterial, viral, fungal, multiple organisms. So we know that T and B cell both are involved. So we say combined immunodeficiency here. And the IgG, IgA, IgM values were low, lymphocytes are less. And the diagnosis is severe combined immunodeficiency syndrome. The enzymes could have been adenosine deaminase deficiency, which is autosomal recessive, cytokine receptor gamma change, which is X-linked recessive, which you correctly answered, which is a very good answer by them. So now I think immuno was your strong point, which is a good pick now. Okay. Second question for you directly to earn marks. You can pounce on it and get more marks also. You know this already. But then the negative marking will apply. Team C, direct question for you. Direct question. Johnny Stewart, 4-year-old boy, presents to hospital with hypotension, lethargy, hyponatremia. Potassium is elevated, is afebrile, normal blood count, but you see extensive oral thrush. He has had multiple treatment courses for thrush and cutaneous candidiasis in the past. HIV infection antibody tests are negative. You also note that at 1 year of age, he has tetany, which was found to be hypocalcemic. Ultimately, he was diagnosed with hypoparathyroidism. I want to know the diagnosis. They are pouncing on it. Everybody else, anybody else wants to pounce? Team D is also pouncing. Yes. And E and F are also pouncing. Okay, so we asked the team C to all of them to write down the answers so that A is also pouncing. B is also. Everybody has pounced now. This is a unique question. Everybody wants to make marks. Everybody wants to make some marks here. Very good. That is the spirit of the negative marking. More higher reward, higher penalty. Okay, our team is checking the answers that they have written. Everybody has written. Only A and B have gotten it right. They get full plus 30. C, D, E, F get 15 minus. 15 minus? Yes. So I always want to deliver the good and the bad news together. Now, let us see the keywords again. Let's see the keywords. What were the keyword? So he has low sodium, high potassium. So we think there's something wrong with the adrenal. Then we see candidiasis, some immunosuppression, but the HIV is negative. And then he has hypoparathyroidism also, another endocrine problem. Endocrine problem, immune suppression, we add them together, hypoparathyroidism, candidiasis. If we add them together, the answer is autoimmune polyendocrine syndrome type 1, APECED, autoimmune polyendocrinopathy, candidiasis, ectodermal dystrophy is the answer. It was all APECED was written in the question. We had given different keywords. So I hope you see that if my eyes goes to the correct keywords, I'm able to read it correctly. Otherwise, the question flies off. Everybody understands this? Everybody follows? Okay. Now, I think there's no more question in microbiology for them. Okay. In the immuno for them. So team D, now you get to choose your system. Team D. Okay. So let me first open the choices for you. You can take cardiovascular system, neurology, endocrine. They want to take cardiovascular system. Okay. Is that your strong point? Or this is all that is left? Okay, now see. Cardiovascular system is your question. You get 2 questions. Everybody gets a chance to pounce and bounce. Okay? Everybody, team D. Direct question for you in the cardiovascular system. A woman of the age 70 years, 5-year history of hypertension, which was requiring more medications. Now she's on 5 medications, including a diuretic. But still the BP is 165/95. Although the patient is asymptomatic, physical examination is normal. Potassium levels have persistently ranged from 3.2 to 3.5 for many years, despite potassium supplementation, which have been attributed to her diuretic use. Why is she not responding to antihypertensive therapy? What is the underlying mechanism? What is given in the question that is the reason for her not responding to antihypertensive therapy? And we want to know the underlying mechanism. You have to answer completely to get the mark. Okay, team D, direct question for you, time to pounce. Anybody wants to pounce? Team C, are you pouncing or are you talking? They are not pouncing. Okay, anybody wants to say anything? Should we pounce window? Close. Pounce window is closed. Team D, now you can directly answer only. Team D. They are calculating. Very good. Some very complex calculations are there in the question, so they have to calculate. Should we pass on the calculator also? Team D. What is in the question that is leading to a problem in the antihypertensive therapy and why? Should we pass? Okay, can you be louder? Yes? Why? She's not, dietary sodium restriction is not written in the question is what he is saying. So we pass it to the other team. We go to team E. There is renal artery stenosis in her, but Okay. Team F. Team F. They say pass. Team A. Team A. Team B. Hmm? Okay. Team C. Hmm? Hyperaldosteronism. Why? I don't think we can give it to any of you. So the key word in this question was potassium. So she has hypokalemia. She has hypokalemia, and hypokalemia reduces the sodium excretion by activation of thiazide sensitive sodium chloride co-transporters via the WNK pathway, and that sodium retention is leading to the fluid retention, and that is leading to the hypertension. That was the answer. It was a very tough question. It was actually a very tricky question in this. I think the credit goes to the quiz master here. I think he deserves a big hand for the high quality question that he has created here. Okay. Now we have a direct question for the team D. You have a direct question. Direct question now. You can answer it and let's see. Okay. 84-year-old woman is seen by her primary care physician for evaluation of severe headache. She noted that several weeks ago and now they are getting worse, but she has no visual aura. Intermittently, she is losing vision in her left eye for last few days. She has jaw pain while eating. Medical history shows coronary artery disease, which required a bypass graft, diabetes, hyperlipidemia, mild depression. Full review of symptoms is notable for night sweats and mild low back prominent in the morning. What is the diagnosis? Team D. Team A and E have already pounced on it. Team D. B is also pouncing. See the pressure when everybody else is asking for sheets. Team D, it is a direct question for you. This one is a very simple question. You can actually answer it. Pounce window? Open. Pounce window is still open. It is over now. Team D, you can directly answer. Who all has gotten it right? A, B and E have gotten it right already. They've gotten plus 30. Team D, your chance to get 20. Giant cell arthritis is correct. You get 20 marks. You should have pounced on it. It is giant cell arthritis. So let me show you the keywords. Headache, no visual aura to rule out migraine, visual loss and jaw claudication are typical for giant cell arthritis. There is some type B syndrome, symptoms like night sweats and mild low pain, but together we gave a diagnosis of giant cell arthritis, which is correct. So you could have actually pounced on it, but you let other people get more on it. So now team E, your chance to select the system. Okay, we go to the system now. Team E, you can pick up the system now. You have only two choices: neurology, endocrinology. Team F, you already know you get endocrine. Okay, don't worry. Okay, now Team E and neurology. I'm clicking on neurology, everybody. There are two questions for Team E. Two questions, everybody. Focus on it and pounce on it. Take the marks away from them. Okay, Team D, ready. Others stole your marks. Now use your chance. Bounce. Okay, 4-year-old boy, worsening unsteadiness, while walking, slurring of speech. Medical history is significant for recurrent respiratory tract infection. His sister died of overwhelming sepsis at 13 years with similar illness with recurrent respiratory infections. Parents are normal. Birth history is unremarkable. Immunization is up to date. CNS shows truncal and gait ataxia, dysarthria, gaze-evoked nystagmus, abnormal saccadic eye movements. Deep tendon reflexes are normal. Pulse is 100 per minute and regular. BP 90/60. Bilateral scleral vessels are dilated on fundoscopy. No pain, itching or discharge. Okay, gross and finer motor age is 2 to 3 years, otherwise developmentally normal. AFP levels are 17.8, which are higher than normal. IgG is 910, but normal. IgM is normal. IgA is 2 standard deviation below normal. Chest X-ray shows absence of thymus. MRI brain is shown. You want me to continue with the history or you want me to show the image? You want to see the image first? See the image and then you can bounce, okay? See the image. This is the image. This is the image and this was the history. Time to bounce. Team E has bounced. A has bounced. Yes. B has also bounced. A, B, and E have pounced. Okay. Who all have given it right? So I think they are the main team, so we don't pass now. We don't pass, so A, B, and E get full 30 marks for it. Any audience, any guesses? So now see, let us see the keywords here. Let us see the keywords. You have, walking problems, slurring of speech, cerebellar, immune suppression, recurrent respiratory infection, familial. The sister also has similar problem, gait ataxia, truncal ataxia. And another thing that you see is dilated scleral vessels. So there is some telangiectasia, some ataxia. Put them all together. Deep tendon reflex are normal. No involvement of the brainstem and the spinal cord here. So put them all together, we get an answer of ataxia telangiectasia was the answer. Ataxia telangiectasia. And what was the MRI showing? Cerebellar atrophy. So look at the size of the cerebrum and the cerebellum. You can see it is much smaller. So there was cerebellar atrophy in the picture. So you made good use of it. Very good. So they could actually pounce on their own question and get more marks from it. That is the spirit. Team E. Direct question for you. Direct question for you. Now this question can make or break. Okay. 43-year-old white female comes to hospital with pain in the left eye, left upper lid ptosis. However, she has no difference in perspiration between the two halves of the face. Non-smoker, no injury, no ocular, cardiac, vascular, neurological disease. Neuro-ophthalmological examination was normal except for 1 mm upper lid ptosis, meiosis, mild anophthalmos. There is no keratodynia, no carotid bruit. The chest X-ray is shown. You have to make a diagnosis. Do you want to see the chest X-ray? You want to see the chest X-ray, team E? Okay. You've seen the history? Okay, you've seen the history. Okay. This is the chest X-ray. There is a reason for the chest X-ray being there. But the reason may not always be evident. You have to look at it carefully. But the quiz master may not always be helping you. Just like the examiner. You want to see the history again? Or you want to keep looking at the X-ray? Pounce window is over now. Pounce window is over. I am going back to the history. A time to answer it directly, team E. Otherwise, you will bounce to other teams. Team E. She's saying there's a cervical rape. We pass it on to the team F. That is wrong. She already said that if it was right, we would have given it to her only. But it is wrong for you as well. Team A. Team A. What do you want to say? Very difficult question. Yes. Paraneoplastic. Okay, we pass it on to team B. It is not right. Team A. Yeah, but why it has happened? What is it? Ottner. Ottner. Okay, we pass it to team C. Okay. Okay, that is not right. So, do we have anybody else who can? Team D. Yes. You want to answer? No. So, they don't want to answer here. So, let me show you the X-ray again. The X-ray chest was actually totally normal. There was nothing in the X-ray chest. But why we are showing a X-ray chest? Because the history was of Horner syndrome. So whenever we see Horner syndrome, we wanted to rule out Pancoast tumor, but the chest X-ray was totally normal. There is no Pancoast tumor. There is Horner syndrome, painful Horner syndrome. Anybody? But no mass at the neck, no carotid bruit, and their perspiration fibers are preserved. So this is the classic history that you get in a internal carotid artery dissection. This is the internal spontaneous ICA dissection that has happened here with painful Horner syndrome, which was the presentation. It's a very difficult question. But the chest X-ray was given just to rule out something, not to show you something. Okay, so that was the reasoning for the chest X-ray. So none of the team could get it here. So we go back now to the subject selection. Yes, you have already done your 2 questions. We go to the team F for the endocrinology questions. Nobody wants to do endocrine. Only the last team has to do endocrine. So we go to the endocrine now. 2 questions, direct endocrinology questions. and you can make or break the quiz on these questions now. Okay, everybody, team F. 55-year-old man has episodes of diaphoresis, dyspnea, diarrhea for 10 months. Abdominal discomfort in the umbilical region. Upper endoscopy was normal. CT scan was done, which will be shown to you after this. Camera endoscopy was performed and there was a mid-jejunal mass arising from the wall, leading to multiple episodes of subacute intestinal obstruction. On laparotomy, a 5 centimeter submucosal mass was resected and it shows nest and trabeculae of round cell pink granular cytoplasm. You want to see the CT? You want to see the CT? This is the CT. I want to see the diagnosis and what heart lesion do you expect in this case? I want to know the characteristic heart lesion and the diagnosis. What do you call that heart lesion and what is diagnosis? Pounce window is open. Yes, team C has pounced. Yes. Anybody else wants to pounce? The window is still open to make marks. Okay, the D has also pounced. B has also pounced. Window is now closed. No more pouncing and bouncing now. Team F, you can directly answer also after that. This was the question now. Okay, and the team D has also pounced. Team D has also pounced. Yes. Team F, start thinking. You can directly answer after this. After they have answered, they have pounced answered. Team D, Team F, you can answer directly. Team F, you have time to discuss with each other. What is the discussion going on? Either they're right or they're wrong. Be precise. You want to change your answer? He wants to ask some answer to you. I hope no cheating is going on. Okay, Team F. Okay, what do you want to say? Serotonin syndrome. And what is the subcanticular plaques are the characteristic finding here? So that is not correct. That is not correct. That is not correct. They have already said this. They have already said, they given their answer. They have already pounced ना, तो अब थोड़ी आएगा वो. अब नहीं आएगा. अब तो it will go to A. Team A. Carcinoid is TIPS is correct. They get it correct. Team A has got it correct. So this was the keywords. Let me show you the keywords here. You had diaphoresis, dyspnea, diarrhea. We started thinking of carcinoid. You did not find it on upper GI endoscopy, but we found it in the jejunum, in the submucosal area, with nest and trabeculae of round cell with pink granular cytoplasm. And the CT scan was showing? What was the CT scan showing? Liver metastasis. Liver metastasis. Multiple liver lesions. Liver mets with a jejunal mass. Okay, so we think of carcinoid syndrome. Carcinoid syndrome. But what is the heart lesion that you want to see? That was correctly answered by the teams. It is TIPS. Tricuspid insufficiency, pulmonary stenosis is the answer. Everybody clear? Okay, so we have one more question in this systemic round. It is a longer round, but we come to the final question for Team F. Final question for Team F. Okay, 10-day infant presented to emergency department with 3-day history of poor feeding, lethargy. No fever or irritability was noted. He was born at 40 weeks gestation by emergency cesarean, no complication. Birth weight 2.8 kg, length 49, head circumference 36 centimeter. Antenatal scans were normal. Family history is insignificant. He is crying, bradycardic, sunken eyes, normal mucosa, slight depressed anterior fontanelle. Respiratory rate is 50 per minute, saturating 99% air, chest is clear, a systolic murmur 2/6. Examination of the respiratory and abdomen were normal. ECG shows broad complex bradycardia. Blood gas analysis shows a pH of 7.3, bicarbonate of 16.1, sodium 112 millimole. You can see the normal range on the side. Potassium 9.7. You can see the normal range on the side. Ionized calcium 1.16. You can see the normal range on the side. Examination, he had normal male genitalia, but the pigmentation was noted to be darker than the infant's skin tone. I want to know the diagnosis and what is the abnormality in this condition. Okay, you can pounce on it now. Pounce. Team C has pounced. Anybody else wants to pounce on it? I want to know both the things, diagnosis as well as the abnormality in this condition. Team C has answered it correctly. Now Team F, this is your final direct question to make marks. Anybody wants to pounce on it? The pouncing window is still open. Still open. Close now. Close now. You were discussing too long. It is closed now. It will now come as a pass if they don't answer. Team F, what do you want to say? Team F, what do you want to answer now? Quickly. Team F, they don't want to answer. Team A. Okay, pass to Team C. They've already answered. So D, E. So we give it to Team E then. We give it to Team E. So we give half to them, half to them. Yes, half marks to Team A and half marks to Team E. So this was the history. Male infant. Male infant is the key here. Sunken eyes, dehydration, acidosis, sodium is low, potassium is high, adrenal problem, normal male genitalia, but pigmentation because of ACTH excess. So we came to the answer as congenital adrenal hyperplasia, and the answer that we were looking for was 21 alpha hydroxylase deficiency. So we give half of marks to A and half to E, which one had answered the diagnosis, one had given the enzyme correct. Okay, so at the end of this tough round,